Hi, it's Dr. Centeno, and today we're going to talk about treating a neurosurgical atlanto-dental interspace, or ADI, with the PICL procedure. So there are different CCI subtypes, and today we're going to be talking about atlantoaxial instability in the frontal plane, which is sometimes picked up through an excessive Grab-Oaks measurement and sometimes an excessive ADI or atlanto-dental interspace. And if we look at what the ligaments do in preventing the ADI, first we need to understand that this is where the ADI lives, or the atlanto-dental interspace. So that's the space between the dens and the atlas. So it's going to be the transverse ligament back here and the alar ligaments that will prevent that from happening as the person goes into flexion, because in that case, this is going to be going that way, and the dens is going to want to go back that way. So the ADI, again, is this distance between C1 and C2. This is the dens here, and this is C2. And this is C1 up here and C1 back there. So this distance between here and here, as measured right there, is going to be the ADI, or atlanto-dental interspace, and it shouldn't be more than 1 to 3 millimeters. So this is an older woman with neck pain and headaches and random neuro symptoms in her body after a car crash. And we got a DMX which showed a surprisingly severe ADI. So much so that, I needed to send her to a neurosurgeon to make absolutely sure that they didn't want first crack at this, because rather than 1 to 3 millimeters, she had closer to 10 millimeters. And enough to certainly freak me out. The neurosurgeon didn't want to operate. And, at that point, I was going to send her to another neurosurgeon, but she wanted me to try the PICL procedure with direct injection of the alar transverse ligament. So I agreed to do that, but obviously told her she needed to wear a hard cervical collar when she was in the car, et cetera, et cetera. Now she came back at around that 4-month mark and reported about 75% relief. A lot of those random neuro symptoms were gone, but I wanted to get a second DMX to make sure that we were heading in the right direction because of this severe ADI before we considered a second PICL procedure. So these are the images here, and this is her pre-procedure DMX showing that huge ADI right here. And then post-procedure, I was really glad to see that ADI was cut in half here. And she had much, much more flexion, meaning that it didn't get any bigger than that, and she attained a lot more flexion than she had done in her pre-procedure DMX. So this is actually the ADI from over here that I just transposed to over there, so you can get a sense of how much her treatment ADI went down. So in her post-procedure DMX, a big improvement in the atlanto-dental interspace. So I now feel comfortable enough to allow her to do a second PICL procedure to see if we can get that tighter, and I'll keep you informed of where that goes. So in conclusion, her ADI is now much less scary after a single PICL procedure where we directly injected those ligaments with bone marrow concentrate from her rather than fusing that area. We're going to proceed to PICL number 2, and it's unlikely now that she'll require surgery, so that's really great news. So thanks so much for watching, and have a great day.